So when we're looking at thyroid function, we often measure something called thyroid stimulating hormone and also T3 and T4 hormones. And there does appear to be some changes in the ratios of these different things that we test for that traditionally thinking would say, oh, that's suggesting the thyroid is no longer as active. But when we look at patients clinically, they're not suffering the effects of hypothyroidism. They're not losing energy. If anything, they're getting more energy. So I think what we're finding is that our existing paradigm of understanding thyroid function is based on those people and individuals on a high carbohydrate diet. And we have to start to interpret those blood results differently when people are on low carbohydrate diets. So certainly there's lots of people, they'll put in a blog post about how a ketogenic diet damaged their thyroid, but at the very same time they won't be complaining about any symptoms of hypothyroidism. And I think it's purely that we are certainly getting changes in the blood tests, but they're probably improvements, and we're just not used to seeing blood tests in this setting.
Perhaps a little bit like insulin. You go on a low-carb diet, you get improved insulin sensitivity. You also get improved sensitivity to your thyroid hormone, T3 hormone. And so you don't actually need so much of it because you've got more sensitivity to what's there.
And is there any risk in fasting or intermittent fasting with low thyroid function?
I haven't come across that. I've seen several patients now, and thyroid people often come in with thyroid problems, but they don't develop thyroid problems.